A very good evening. Once again, joining Sushma Morthania, Director General India SME Forum, welcoming you at the fourth virtual conference of the India Health and Immunity Virtual Expo 2020. I welcome all our esteemed panelists today, viewers and India SME Forum members who have been regularly joining us each evening at 4:30 p.m. Today's virtual conference is on healthcare management and infrastructure during pandemic and thereafter. We all know when COVID started, we were all unprepared. We had no idea the kind of challenges it was going to throw at us and the challenges it threw upon us. We were completely taken off guard. We had no preparedness for manpower. We had no hospitals. We had no testing kits. We did not have the stock for sanitizers. There were no masks. And there were a series of problems. There were no doctors, there were no paramedical staff, and people had to work continuous shifts. And we really were in a complete firefighting mode, and we managed somehow. But I guess pandemics like COVID, and we don't know what is yet to come. I guess we have our lessons to learn with this pandemic, and we have to prepare ourselves, our infrastructure and healthcare for many more such issues to come in future. So with that, I think today's discussion should revolve more around that, the kind of opportunities this pandemic has thrown in the healthcare sector, and what support we can seek from the government, and what challenges we continue to face is what should be the discussion today. And I'm sure our esteemed panelists have many insights and experiences to share, and many learnings for our entrepreneurs who are viewing today. So with that, I take the pleasure of inviting our August panel today. I invite Dr. Rene van Berkel. He is UNIDO representative in India, and he coordinates country offices in Afghanistan and Bangladesh. He has 30 years of professional experience in resource efficiency and cleaner production, industrial productivity and sustainability, with extensive international experience in Europe, Australia and Asia, covering a variety of manufacturing and related sectors. May I request our other panelists to kindly mute your mic, and welcome Dr. Berkel. Our next guest today, may I request all our panelists to please mute our mic. Okay. May I welcome Ms. Feo Williams, who joins us from Nigeria. She is the Executive Director of Relay Supply Limited. It's a health and safety supplies company which specializes in production of first aid boxes and providing health and safety environment training for individuals and corporate organizations. Welcome, Ms. Williams. Mr. Rakesh Pandya.
Thank you. Thank you very much, Sushma.
Thank you. Welcome. We have Mr. Rakesh Pandya, General Manager of Lilac Insights. It's a genetic diagnostic company in the field of reproductive genetics, cancer genetics, metabolic genetics, fetal autopsy, and genetic consultation and counseling. Welcome, Mr. Pandya.
Thanks, Sushma. Thank you.
We have Dr. Siddharth Nandi, an MBBS, and he has been actively performing a full-time duty during COVID at the Sir H.N. Reliance Foundation Hospital. First of all, welcome Dr. Nandi and applauds for the commendable work that you have offered during COVID. He is the consultant medical officer at the Link Art and STI Clinic of Lokmanya Tilak Municipal Medical College, General Hospital Sion and Humsafar Trust.
Thank you. Thank you so much.
Mr. Sudarshan Kumar. He's the first generation entrepreneur and CEO of Integral Labels. It's a technology oriented company which manufactures self adhesive and metal labels to meet the needs of various segments of the industry. Welcome. Mr. Vishal Srivastava, CEO Vincom IT Solutions, a quality certified company and a leading manufacturer of fitness brands, smartwatches, Bluetooth speakers, cable connectors, activity trackers, face masks, and many more. Welcome, Mr. Vishal Srivastav. Mr. Binoy Purushothaman. He's the managing partner of Abhidaksha Global, a startup company, Fodder India, which manufactures a technology-enabled solution to avoid a COVID-related shutdown in an organization. So it's quite an innovative product. And Fodder is also a partner organization for this virtual conference. So thank you for that, Mr. Binoy, and welcome. And lastly, I have the pleasure of welcoming Shri Vinod Kumar.
It's a pleasure. Thank you.
President, India SME Forum, a venture fund partner, mentor to more than 11,000 enterprises, around 3,000 women entrepreneurs, and he is an investor. He invests in small and medium businesses from 2 million to 20 million ticket size. So welcome to you, sir. And today's session will be moderated by him. So over to Mr. Vinod Kumar. Thank you.
Thank you, friends, and thank you, Sushma, for that kind introduction to everybody. What I wanted to add today is that we are at this point in time talking about very, very strategic steps that India needs to take. In fact, all countries around the world need to take when it comes to COVID management, especially with the sort of, I would say a certain amount of uncertainty which is looming over what exactly is going to happen, how are the vaccines going to come, how many people are going to vaccinate it. But just before this pandemic and even during the pandemic, if most of us remember that India, under the leadership of Prime Minister Modi, set the ball rolling to build a robust healthcare ecosystem in the country. And this was called the Ayushman Bharat, which was the step in that direction, wherein the program covers hospital costs of up to 500,000 rupees for the poorest 40% of Indians. Now, my feeling is that COVID can be an opportunity for all of us, for the government, for the public, for entrepreneurs, to strengthen the social healthcare system in the country. Whereas Ayushman Bharat is looking at 500 million beneficiaries and providing coverage of up to 5 lakh rupees or 500,000 rupees per family per year. At the same time, this COVID-19 pandemic has been a wake-up call to all politicians, corporates, policymakers. The fact that preventive infrastructure, proper healthier environment, and humane living conditions are all essential to avoid the social frailties that stand exposed today. Most of the schools that used to have fitness regimes, playgrounds, green breathing spaces, parks, basic sanitation, today are no longer luxuries. They are all essentials as far as the preventive framework goes. It's also a wake-up call for city administrators when they are talking about town planning. For example, I live in Mumbai and we have this Dharavi here, which is Asia's largest slum, that emerged as a virus hotbed. And I can call it decades of negligence has converted this into the best example of bad town planning, callous neglect that has now come back to bite us all. A strong housing policy, especially when it comes to slum development projects, to ensure better living conditions and prevent and control the spread of such communicable diseases, is what is the basic required. And what we are discovering very painfully is that linkages to good health are not just the health infrastructure, hospitals, adequate supplies of medical equipment, testing capacities, labs, temporary health facilities. All of them are very necessary to this entire health, I would say, infrastructure. However, when we look at policies of urban housing, tracking of large transient populations, basic sanitation infrastructure, supply chains for basic consumption, essential commodities, etc., all of them are extremely critical to this entire healthcare scenario. And we've, on one hand, looked at great advances in the healthcare, in the telecom infrastructure, which is a base for most healthcare. We have Vishal and other companies also which have worked in technology for healthcare. But the last mile is still a challenge. And also at the same time, the ability to basically call on standby paramedical or other teams to help is almost non-existent. And which essentially is taking us to a point that this collective well-being is not something that can be ignored anymore. Whenever we have a new building in Bombay coming up, every time the BMC or the government asks them that please put out a certain area for parking. And there is so many buildings and there's so much parking now available. But the fact is there are no hospitals. So essentially the government had to actually set up hospitals in exhibition centers, hospitals in open grounds, and wherever else. Because basic health infrastructure is completely missing. And so far it has been somebody else's problem. So the private entrepreneurs will come and they'll set up hospitals and all that. But now this problem is also of the government, wherein now they are also stuck that this is a much bigger thing, not just to leave to some social entrepreneurs and do-gooders. At the same time, I feel this Abhiyan for basically healthcare is a very good dream, which is harbored by our Prime Minister. And it cannot be left on its own as an independent effort. It's a series of coordinated efforts, actions by each sector and each person in the economy to ensure that our reliance and dependability on external or foreign produced goods is a slightly diminished, while at the same time we have all the infrastructure to deal with it at the local ground level. And with that, I'd like to ask all our friends here one by one, what are the challenges that you feel? This is what I could figure out. I'm not an investor in a healthcare enterprise yet, but I feel this 500,000 rupees, which 500 million people are going to get as coverage, is a very, very big opportunity. And this is where entrepreneurs can come in and set up infrastructure, because this, to become part of this Ayushman Bharat, can be a big enabler for somebody's business. So I'd like to first ask all of the esteemed panelists here about what do you feel are the challenges that are in front of us that need to be addressed. We are still facing an uphill task with infections not going down, dearth of hospital beds, oxygen not being available. So governments and officers running helter-skelter for finding oxygen to be offered to mildly affected or low oxygen COVID patients. And this is the same story in urban as well as in rural areas. So I'd like to ask Dr. Van Berkel first, as to what is your perspective about the challenges that we are facing?
Thank you, Vinod, for inviting UNIDO, UN Industrial Development Organization, to be part of this. And I think that, yes, it cannot be highlighted enough that we are meeting in difficult and challenging times. So COVID is taking a huge toll on health, humanitarian situation, economies in India and also globally. Of course, the official number stands at about 66 lakh infections, 1 lakh deaths, and an economic downturn of 24%, which is about a quarter of the economy. And then we say India is the second largest after the US. But in terms of infection rate, and this I want to highlight, India is only 79th in the world. So India stands at about the average level of infections, 4,800 infections per million people, and globally it's about 4,600. So in that sense, there's a dimension of scale in there. So there are positives in terms of the numbers, that the early management and the lockdown slowed down the pandemic and also brought time to prepare, as you were also saying, even though it was then hospitals in convention centers and hotels and other places, but at least something could be done in this time. But of course, lockdown is a time bound, and we have seen the challenges really coming during the unlock period. So if I put some numbers out, then if unlock started around the 1st of June, we have since that time, the 4 months, we have seen a 30-fold increase in infections. So it's really, as the scale is now, what you were also saying, we're not quite sure where this will go. But another positive is probably that the fatality rates are lower than global average, much lower. So that is a positive sign, which is maybe a reflection of younger population in India than globally. We see healthcare has been scaled up, and we've seen a lot of innovations also. And that comes to your point of business opportunities. There was no production of PPEs before in India. Now I think it's the second largest, if I'm right, but the figures are unreliable. At that point in time, we see that people started manufacturing ventilators, people started manufacturing test kits. We saw today the news that a new test, a 500 rupee test, is about to be approved. So there's lots of positives also in the challenges. And I think that is also a little bit of the story around healthcare for India. So we see that the challenge is what you were saying, the scale of the provisions of basic health infrastructure lags behind of what is there in terms of doctors per thousand of people, for clinics, hospital beds. It's all on the very lower end of the scales globally. And I think what augments on this is a bit the affordability gap. So if you have money, you can get the best healthcare in India. And if you happen to sit in this group of 500 million, you're just waiting for your turn in that sense. And we see that from the UN system reflected as the public health expenditure is still at the lower end. So India is at about 3.5% of GDP, whereas the global average is about 9.5%. Also, these are a bit fluctuating, but could be 3 times more. And I think what is also an important component of that is that we see also the poverty trap coming back. So there is good estimates from the World Health Organization that about 60 million people in India are again poor because of healthcare bills. So as somebody in the family turns sick, and then people who has a family which has worked hard to come above the poverty line just drops back because somebody breaks a leg or somebody falls or has a need for heart surgery or cancer or whatever else that might be, not major expenses, not that necessarily, but that is really the opportunity. I think there is that, what you were saying, Vinod, an opportunity for the private sector to also step in with healthcare facilities, make the investments in hospitals, clinics, and associated ones. But the challenge will then also be, where do we get the capacity for staffing of these facilities? Because we've seen that we were able to quickly upscale, create beds and hospital facilities, but where do we staff those people? So there will be a parallel need for investment in the capacity building. Doctors and nurses, we cannot train overnight. Unfortunately, but it's just the reality that there will be a time lag to actually do this. And maybe there is some need to see what India can do to bring some of the Indian world-class trained doctors and nurses back to India to help and take the lead in scaling up the health infrastructure. Maybe I leave it there as a first contribution. Thank you.
Well, that was that was almost an overview of the entire thing, Dr. Berkel. I'd like to go to Dr. Siddharth Nandi here, who's been part of the entire fighting at the forefront of this entire pandemic. So, Dr. Nandi, what is your experience? Having been at the facing end, the front end of this entire pandemic, what is it you felt? Where the challenges? That are seemingly small and you can now overcome them easily.
Okay, first of all, good evening to everyone. Thank you for getting me on the panel. So I have jotted down a few points which I realized while doing my COVID duty in Mumbai. So first of all, the thing is, when the pandemic just came in, at that time, we did not have proper and adequate amount of infrastructure and facilities to deal with it. And also not adequate number of healthcare workers, including doctors, nurses, ward boys and all, to combat with this situation. So what happened is, in the hospitals, they did a rechannelizing or a reconfiguration of the services. So in the hospitals, we would have a few beds from the total number of beds which were dedicated for COVID patients. Now, the transmission rate of this infection is very high. So the patient load went on piling up every day, whereas the number of beds available were very less. And this resulted in a huge scarcity of medical facilities being provided. From my own personal experience, like I have gone through various experiences in the last 5 months, wherein we would have patients coming in with gasping for air, like with air hunger, we call that. But we couldn't provide them proper medical care because of shortage of beds, and then we had to refer them to other hospitals. And then after the patient went to that other hospital, he would be referred to some other third hospital. So meanwhile, many a times the patient would collapse in the ambulance itself. So this was a very grave scenario which I would frequently come across while performing my COVID duty. Initially, one more point I would also like to mention, that there was a shortage of grade 2 personal protection equipments, and also shortage of masks. But later on, that was very well covered up. The loss which we had initially due to shortage of PPE kits and masks was later on very well covered up by the healthcare system in India. Initially, the testing facilities were also very inadequate. Like in Mumbai, there was only one hospital which was dedicated to COVID in the beginning. That was Kasturba Hospital. But gradually, then other hospitals also started pooling in. They also started reserving a certain fraction of their total beds for COVID patients. So these were the various challenges I realized while doing my COVID duty. There are some situational challenges. I doubt whether they'll be relevant here or not, but I'll still bring up the point. So patients are of various kinds. There are COVID patients, there are non-COVID patients, then there are patients who fall into the indeterminate category. Now, there is a certain class of patients who are on treatment for non-COVID conditions, like for cancer or pregnant ladies or people living with HIV or people who have chronic kidney failure and who are on regular hemodialysis, or people who have to take regular albumin infusions for liver diseases. So they have to keep coming to the hospital at regular intervals to continue their treatment. But because of the COVID pandemic, the COVID the load of COVID patients increased on the hospitals, and naturally these patients got neglected. So their treatment got delayed. Also, there were certain patients who required care. Like suppose if a fracture patient walks in, he requires care, but he doesn't require emergency care if the fracture is not that severe. But they have to keep in touch with the hospital and come for repeated visits. Now, because of the COVID load, even such kind of patients got neglected, like who had to be called back repeatedly into the hospital. Uh, this was also one of the challenges. Another challenge was like discrimination against healthcare workers and COVID patients and survivors. So that's it from my side. Like the challenges I would enumerate till this much.
Quite a few challenges. Rakesh has also been a part of this entire industry, and we know detection was initially a big issue, and we were getting tests from all over. Then there were some tests which were bought in. Then we were said, no, don't do it only in government, do also it in private labs. So a lot of things we've been through. Rakesh, please shed some light on it. You're on mute. You need to unmute your mic before you speak.
Can you hear
Yes.
me now? Yeah. So thank you, Vinod ji, for giving me this opportunity. And I agree that testing was a big challenge when COVID hit India. And I remember I was every day seeing that we have opened a 4 lab, 5 lab, 7 labs. ICMR is going aggressive in terms of testing facility. But Vinodji, lab like ours, which is a genetic lab, and who can do COVID testing at our facility, we were always challenged with the fact that should we move out of our core area, that is our genetic testing, and we start looking at COVID testing, or we continue to maintain our core. And if you ask me, we decided to maintain and continue to focus on our core, because the core issue of say genetic burden in India, or the babies born with genetic defects, are much more higher, and the number of deaths are much more higher than what it has been reported out of COVID. If you see every day, there are 27,000 babies which are died. And if you see the birth defect burden, 0.5 million babies are born with birth defects. And out of that, 30% are genetic, born out of genetic defects. So at the beginning of your conversation, Vinod, you are talking about prevention. And there are a lot of measures in terms of vaccinations and other things which are being taken in terms of prevention. But unfortunately, the DNA of our body, which makes our body, nobody talks about how we can get a good DNA, or we can detect our DNA in a right manner at the right time, or at the birth time, so that certain diseases, or say certain conditions, or can be prevented. And that's a huge burden. And what I see,
Most people don't even know that there is something like genetic conditioning that you can do,
yeah,
which has turned out to be a big savior for babies that are born after doing genetic detection and all that. I'd also
yeah.
like to go to Theo. Theo is also from Nigeria, so I'd also like to have some perspective from her, Miss Williams, that what is the situation at your end? We are talking about India, such a large country, a federal sort of a nation with so many states and 1.3 billion people. So, with regards to Nigeria, what is your situation? What's your situation been? Did you have similar challenges?
All right. Firstly, I would like to thank the India SME Forum for inviting me to be part of this important panel. The India Health and Immunity Expo is a really, a very important one for this time that we are in. And we have had a lot of challenges in Nigeria as well. We are also a very populous country. And I would say, first of all, whatever you don't look after will not look after you. And that starts from the human being, because we found out during COVID-19 that even those who have underlying conditions, who have gone into obesity and have allowed diabetes or some cardiovascular problems also to creep up here and there, they were, highly at risk. during COVID-19. So COVID-19 to me was not just a public health crisis, it was a crisis of governance, it was a financial crisis, it was a crisis of choices made and consequences being experienced. A lot of my other panelists, like Dr. Raquel, he spoke about, the utter lack of preparedness. This just hit us like a tornado and just, took the winds out of our sails. Because in terms of governance, we had a situation where the healthcare management and infrastructure was mainly for the poor and those who could not afford to go abroad. We had a situation whereby those who were in power, could just book the next air ambulance and fly out. But of course, during COVID, that could not happen. So we began to see different faces of human behavior. So I know a lot of my colleagues have spoken about the test kits, the hospital beds and all, but I want to even dwell on human behavior. So we need to start learning big lessons from COVID-19. If we are governing and we are right there at the top, there must be accountability. And we found world leaders in some cases very recently, a name you all know, who were very lackadaisic about compliance with non-pharmaceutical um, prevention techniques, and you found out what happened. So that all boils down to human behavior, the psychography, how people think, how people act, and how are we followers to our leaders. Because in many cases, people were now telling us that, well, it's a choice between my daily bread and life. If I don't have my daily bread, I might as well not live. And that should not be the case, So we really need to learn a lesson about human behavior from COVID-19. And another big lesson we have to learn is about the supply chains. A lot of us, like in developed countries, we left our future to China. We could import anything. Money wasn't the problem at a particular time, but we know that that has changed now. And of course, money is scarce. And there are a whole lot of shutdowns and shrinkages, even in the economy, in GDP, there are a whole lot of shrinkages and inflation is spiraling. So the supply chain issue needs to be tackled headlong. We need to encourage our innovation ecosystem. We had 3D printers making face shields and nose masks. Dr. Berkel, you spoke about ventilators. All of a sudden, the technology that wasn't there, it became there. It was given birth to, and people had to do what they needed to do in order to survive. So we have the supply chain issue up till now. Manufacturing should not just be a question of national pride right now. We need to get our factories working so that each country can be self-sufficient, or rather have at least a bigger, pool of materials, healthcare materials, from face masks to sanitizer to ventilators to hospital beds that they can draw upon. And then another challenge we had was poor information management. So we have a whole lot of people who believe wrongly. If you say COVID has no cure, how come they are being discharged from isolation centers? And we're saying, there are treatment regimes. The body creates its own immunity after some time. We have so much, problem trying to explain to people that there is no known vaccine right now, and everyone has to be much more careful. So in a nutshell, I would say the challenges are human, the challenges are from governance and the choices that are being made, and also the challenges have to do with information management and also dissemination of information, getting people to comply and letting them know that your healthcare management starts from you. What I eat today is part of my healthcare. The time I sleep is part of my healthcare. The pollution I choose to release into the atmosphere is part of my healthcare. We are all in one world, and this has shown us that inexplicably we are all linked in one way or or the other. India, Nigeria, China, the United Kingdom, and every other country, we are linked in this huge web. And it behoves on all of us to be very responsible in tackling this pandemic and any other that is to come. Like Shishma has said, we have to be prepared for whatever the world would bring, next time around. Thank you.
I completely agree with you, Ms. Williams. That was very strongly worded, but I completely agree with you. It's now or never for most of us, especially if we even have a shred of thought for our future generations. That is the least we can do at this point in time. So we talked about various challenges, and then we have a few entrepreneurs here who've taken the challenge head on and said that why don't I contribute to this? So I have Binoy here. Binoy, tell me, all the challenges for entrepreneurs. We talked about the opportunity in the hospitality sector, in the hospital sector, the facility management sector, and everything associated with, right from laboratories to everything else. So what are the opportunities that you feel are there currently, and which opportunities did you address?
Hi, thanks, Mr. Vinod. Nice to be in such a august panel. See, I am basically a garment exporter. We are a government-recognized one-star export house. So when we opened up, when the government allowed us to open, actually in May, so the first challenge that we faced was the government set up about 5 rules. Like they made it compulsory to wear mask, disinfect, take temperature, maintain records, and contact tracing. Believe me, the hardest task was making people wear masks.
Masks, yes.
In the factory. It's just, we just couldn't do it, right? The simplest thing was taking temperature, disinfection, spend money, do it. But masks, believe me, I live in a housing society, and I had to issue a circular. I'm the secretary there. I had to issue a circular for making people wear masks. So imagine my factory, workers, uneducated ones. It was a very big challenge. So what we did was that we tried different things. We linked the mask to the attendance. We put up a QR code in the masks. We told them, we put up a scanner in the gate, a normal mobile scanner, and we told them that if you scan the mask, only then you are allowed inside. So then that became a basic things that to do. So that was a big challenge. So after that, then what we faced next was that people told that, okay, the masks are not comfortable. Then we had to again innovate. We checked the mask in the market, and we found that most of them were like duct tapes. There was no space inside to breathe. If you even I brought all the big brands. I don't want to take the names. I don't want to spoil the names. All the big brands in the market. I bought it. A lot of people made a lot of money with these things. I know a robotics company which went into making sanitizers. See, robotics and sanitizers. So there are a lot of people who are making masks. And the big ones, the big branded ones making masks were just duct tapes. They were just covering the mouth. You could not breathe. So we had to see, we had a garment industry. I had an industry of 17 years experience. We collaborated with our Italian designers. Then we bought up a different type of mask, which had about 40% space inside it to breathe. Simple. Not rocket science. You just need to add some extra fabric. So all the big brands were trying to save that small fabric. End of the day, it doesn't cost anything. So we made that mask. Then the next challenge was the recording, the temperature, the records. The government wanted us to maintain records. Okay, when we opened, it was 25%. We could do it manually. Then 50% they allowed. Then they allowed 75%. I could not manage. I had to put 2 people in that to manage the records. Then India being the software capital of the world, we took help from a Coimbatore-based company. We asked them to write a code. We told them, okay, when you scan the mask, and you take the temperature, the security takes the temperature, it has to be automatically populated to my HR directory, the employee list. So they gave a code, wrote a code to us, and it was very simple. Then I passed this idea to a lot of people, and they all liked the idea. Then the next challenge was that they told, no, I don't need somebody to take the temperature, give me an automated one. Then I went back again to the drawing board. We told the software guys to do it, and we built a scanner. It's an automated scanner. I'll send a video to the August panel later on. So you come stand in front of that, it will take your temperature, it will scan your barcode, and then it will automatically populate your register, the database. So if you have 100 employees, in a day you can pull out the data of each individual, weekly data, daily data, monthly data, and something like that. So it's an automatic scanner, which is the version 2, which we are not doing. So this was the challenge that we face in our industry, and then we wanted to spread it around the world around. So we spent it to a lot of corporates in Bangalore, in Coimbatore. We took a trial for about 45 days, and now finally it is running in around 7 or 8 places. We just launched our product through India SME Expo. So India SME was our launch pad.
I would say it has very good potential, because I know a lot of places that you have situations where there are 500, 800 employees, where it's physically not possible to
ours
actually.
is like it's a software, so you can do it across the geography. Like a company sitting in US can manage its operations of Africa, of India, of Australia. It's scalable. It's a software, so you can do it. It's from n number of people. It starts from 1 to n number of people, and it covers the entire gamut that the WHO or the government wants. The government wants you to wear a mask, you to trace the contact, you have to maintain a record of your temperature, the in and out, and maintain records. These are the 5 things that the government wants, and this software does it. But end of the day, when we went out to sell this, and the last point, as the Maruti Suzuki ad says, "Kitna deti hai?" End of the day, it all boils down to that. The last question was that, "Kitna deti? How much is this?" End of the day, what it boils down to. Then we had to reinvent. We had to reinvent
any which ways. So you
we
have
had to reinvent, and we made it $1. We priced it at $1. I had clients, government clients in Italy, in Hong Kong, in Dubai. So I had to. So now my solution is it starts from 95 rupees. It goes up to 130 rupees, 140 rupees per user. Because my mask, the mask that we made, it's with an Italian collaboration. It's a 3-layer mask. We give guarantee for 30 washes. And my Italians, they don't take my word for it. They want a test. So I had to do it the Intertech test, the ITS test, the Textile Committee, and the Citra. But in between, Citra closed their testing for masks. They were doing PPEs. So finally, we got it open only 2 weeks back. And we finally got the test. And ours is like 96.2% bacterial filtration efficiency. That's the best in a cotton mask. And our best part is it's 100% cotton mask. There's no polyester element in that. So all my reports are ready. We send it to my clients. So we are now launching it in Italy.
Yes.
By next week, and thanks to India SME is the platform that we launched this product.
Well, we have to take it further. You've just launched, so we need to take it further to every nook and cranny.
I'm looking forward to you and your guidance, because this is a startup company. See, India SME, the SME, I think should expand to SSME. You should include startup. Okay. See, that is a new thing. Next thing, you are spending a lot of
small industry owner anyway. So now this is another innovative setup you've set up. So
you are spending a lot of. See, you are the buzzword in small and medium industries. Now you should not lose the opportunity for that next S. There's another S. It's the startups.
We'd be glad to, definitely.
I am a startup. I am a startup.
I think we're setting up this incubation center, hopefully with Unido, wherein we will incubate enterprises and also accelerate those that are already in the first stage. So that is something that we're already looking at, and hopefully I think that should come by. I'd like to go to Dr. Van Berkel. We talked about a lot of things, and then we know the fact that when it comes to India, we dispose of everything just anywhere. Which I fear is going to be the next big issue in India. All of these equipment, gloves, PPEs, whatever we are using, masks, disposable items that we are using. The other day there were a couple of stories in newspapers. Then there was one news channel which did a story on this. So are we effectively actually even addressing biomedical waste in India? And, isn't it very concerning that we may not have a really, formidable strategy to deal with it, especially in the face of this pandemic?
Yes, thank you, Vinodji, for raising this question, which is close to my heart as being trained as an environmentalist. I think this is really the unaddressed issue. That what do we do with the biomedical waste? In principle, I think we have to say that that India has quite decent rules for biomedical waste management. The biomedical waste management rules of 2016 and then the amendments of 2018 and 2019. So they enforce strict source segregation in hospitals. So you have the red, the yellow, and the blue, and the green bins. And if you then treat it properly and control it all the way to final disposal, that is quite okay and up to international standards. Of course, there are some differences on what should be in which bin, but by and large, that is good. But we see that the implementation and enforcement is inadequate. So too many hospitals, and this was long before COVID, and we see that there is inadequate attention to this, that the biomedical waste management in healthcare facilities is regarded too much as a cost and not necessarily as an item that is important. And I think that UNIDO was working on this issue for quite some time already, but more from the perspective of the environmental impacts, because if this biomedical waste goes to incinerators, it causes unintentional POPs, and that is an obligation under the Stockholm Convention. So from that side, we were working on this, and since 2017, we have been working to set up effective and efficient biomedical waste management systems in 160 hospitals in 5 states. So that involves source color-coded bins, and then color-coded trolleys, then managing and tracking with barcoding and tracking up to final disposal, and also then use of PPEs in that. And I think that is showing now that these hospitals which have been supported, they report to us near zero infections from biomedical waste management. And this, I think it's a very sensitive issue, but we cannot hide for the fact that infections are happening in hospitals and in waste management sector, and where biomedical waste has been the cause for the infection because of poor separation out of this. And I think this is we don't know whether we talk about thousands or lakhs of people who are infected, but clearly there's an issue, and hospitals healthcare facilities are concerned about sharing the data because they don't want to scare off all the workforce. But clearly, with proper systems, it is possible to prevent infections through waste management. And if we were all proverbially say to pull up our socks, we can really do this and make this happen to do the source segregation and manage it. And of course, then we have seen this biomedical waste increase quite rapidly with the COVID infected waste. So basically every bed sheet, every mask, every ampule that has been used is potentially a hazard, whether it's in the community or at home or in healthcare facilities. So even the data on how much waste we have from COVID pandemic is a bit tricky at this point in time. We have seen some data which suggests that it would be about 8 kilograms of COVID contaminated waste per COVID infection. If we do that, that would be 50,000 tons in India, with the current 6.6 million cases as an average figure. But we've also, last week I was speaking to the West Bengal Pollution Control Board, they say it's 17 tons a day in just Kolkata, which means that it would be at least 4 times more. So we're not quite sure. And then all the issues, it is clear we have seen evidence from biomedical waste treatment facilities and incinerators where the waste is piling up. And the waste is piling up because the capacity is not there to deal with it, and then it's not properly stored. And there's a tendency for, let's call it leakage out of the biomedical waste stream. So it's going out. It's also very attractive because some of the plastics used for medical application are of high grade. So it's always been there. We've seen reports in the media of biomedical waste ending up in landfills or in the community, and this is really an issue. We can't put a number on this, but we need to really emphasize this issue of effective and efficient biomedical waste management. We cannot have a 7-star healthcare facility without fixing the back door of the waste management. Thank you.
Absolutely. I'd like to go over to Rakesh. Rakesh, we talked about biomedical waste also, and then, I come back to the topic when we're talking about, there are quite a few entrepreneurs who went into this and said, we're going to set up labs so that we can control and figure out early detection of things like diabetes and all of that. And we have a laboratory network in India, which is already there. But is it big enough to cater to everybody, A? And do we have everything that is already required for us in India in terms of a laboratory, detection network? which can detect any and all infection, illness before the onset.
Yeah. So Vinod, the to answer you, no, we do not have enough laboratories to give a solution for each problem or medical problem available at this point in time. And also, there is another challenge on the back end when you see in a laboratory is where every testing, where there is a test range available, you have a machine who gives a result. But there are a lot where there are a lot of interpretations required, where there are a lot of scientific team are involved, multifunctional teams are involved. There is so much difficulty in terms of giving the report, and these facilities are not at all available. And as you go in the metros or in class one cities, you have a little better facilities, but unfortunately the guideline and protocols are not being followed all at all levels, and that makes things more difficult for the patient who are walking in for hospital or for a treatment. So at various levels, if you see, there are challenges which are available. So one is the testing facility, what kind of testing facility available in my vicinity. Second, what is the testing facility available, they have a backup team who can interpret the data rightly. After interpretation of the data, I have medical facility available where I will get the treatment of those interpretations which are being done, and then post treatment the follow-ups which are required in terms of managing the disease or the condition. I think everywhere there are a lot of challenges, and India being huge country, logistic remains one of the biggest challenge, and very difficult to manage. I see the condition at this point in time is very, very challenging actually. And just to give you a statistic, Vinod, in this COVID times, 67% of pregnancies are not visiting the hospitals or the clinicians, and they are either managing on telemedicine or they are managing on through other source. But unfortunately, what is happening is they are also they are searching in internet for miscarriages, abortions. Those kind of fears are growing up, and birth defects, genetic defects are going to increase in this COVID time because of non-availability of facility. So we are in a very, very challenging time. We are very, very challenging time.
And therein also, I think, Rakesh, lies a opportunity for entrepreneurs like what Binoy did. Instead of being in garments, he sort of refocused for the time being and said, okay, here's an opportunity, here's a place where the country needs me. I can come up with something, I can make something and offer it to all the people. And that's, I think, that's required for all of that. With the number of people that are needing these solutions and the possibility of creating these solutions for the entire populace, I think that itself is a really big opportunity for entrepreneurs today to come forward and look at offering all these solutions.
I agree with you, Vinod, but the dearth, what I say, the dearth is in the knowledge and the availability of those experts in the area. And I see digital transformation like what Binoy was talking about. He did something digitally which can really help managing manufacturing and back-end services to manage their operations successfully. In in healthcare system also, I think if India builds, there's a huge opportunity with digital transformation. And if we are really able to formalize what kind of medical facility can be done on digital, what kind of facility can be done on in face to face, I think that can transform a lot of these limitations what we are talking about. Because in that case, a person sitting in the remotest of the rural can get connected to best of the medical services available through this digital transformation. And somewhere the awareness, the literacy, the digital penetration, I think this all need to be work collectively. If we work on one area and then we miss one area, I think the loop is not complete. And that's where we really look at the government to really look at 360-degree and work this out. I tell you, if people are aware and if they know we can connect, I think automatically you see the kind of what do you say resolution coming out of each diseases. The See, we always talk about price. We do not talk about the cost. Price is
Cost.
absolute which you pay at the time when any testing is being done. But the burden, if it is done wrongly and if it is not done in an appropriate manner, the cost burden is so high, and that is what is problem for India at this point in time. We
I
are
agree.
focusing more on price, but we are not talking about burden. We are not talking about the cost, the long term implication. I think Fayo talked about health and nutrition. I think so very important that we are taught in the school that health and nutrition, finances are so critical for our living, and we are just focusing on subject, and that's where the change has to come in. Similarly, medical facility, we are focusing more on the treatment, be it be chronic disease, be it be acute. We are not talking about the preventive. We are not talking about genetics, because genetics is a core. If we are able to prevent the disease through genetic solutions, we will have very, very long term good implications on each human being, human
I
space.
agree. In fact, I'd like to take the same discussion to Vishal. I know Vishal operates in Delhi, and he's a technology entrepreneur. But he also, because looking at the number of people that needed masks and all that, Vishal, you also started doing masks at some point in time. What was that about? Sorry, we can't hear you. You have to unmute yourself, Vishal. No, we can't hear you. We can't hear you, Vishal, yet. And Vishal is a firebrand tech entrepreneur.
Sorry,
So
Vinod, maybe you
and he's fumbling with his equipment. Amazing. That's what technology can do to you.
you
In the
send him a
meanwhile,
message in the chat box?
I'll go to Mr. Sudarshan Kumar and ask him, what are the opportunities that you felt came or are still there? You see, we had 800 entrepreneurs today listening in or viewing this broadcast, and there'll be many, many more who will see it afterwards. So, what is it that, Sudarshanji, you are saying that people should look forward to, entrepreneurs should look forward to in terms of offering solutions for this current pandemic and also thereafter for the entire opportunity of offering healthcare to the entire Indian population?
Yeah, good evening, Vinod. Thanks for giving an opportunity, on this panel.
It's a pleasure. It's a pleasure for us.
Yeah, as an entrepreneur, see, nobody thought this situation. Nobody even thought, even in the dream. See, as an entrepreneur, definitely is an opportunity for many, many SMEs. I'm talking about which is supporting healthcare segment. For example, if you take a lot of localization activity, which we are getting now. For example, the entire health segment, they were depending on other countries for their either equipment or which is related to medical. There are many, many manufacturing opportunity which we are getting for the new development. But we have to be ready. For example, if you take as an entrepreneur, as a label manufacturer, a branding activity I'm talking about, we are in the branding activity from last 2 decades. Now the opportunity which has come now due to this situation, where even many German companies are looking at on the Indian SMEs or Indian OEMs to support them. At this junction, there are many opportunities which we are getting and which we have to utilize in a proper way. See, more opportunity, it is something like you have to organize ourselves to meet the challenges. More importantly, whether it is a quality management system or health management system, particularly when we talk about the biometric, particularly bio waste management, we talk about in the industry, EHS plays a major role here,
Yes.
particularly health and safety management. I'm talking about lot of policy which you define and which you follow, aggressively. Definitely this will support, particularly impact on the environment. So the more importantly, so we have to really think how we are going to establish the system which we are going to implement and which we are going to monitor in day-to-day activity. When it comes to opportunities in the medical segment. Again, it is more and more opportunity, even right from a small SMEs to big ventilator. For example, if you take many auto OEMs started looking at manufacturing ventilators today. They were not in the health segment. Now they have switched over, like Ashok Leyland or Wipro, Bharat Electronics, basically being a defense company, R&D company. Now they are looking at how they can able to manufacture, with their technology, taking the support of DRDO. DRDO is supporting all the SMEs, including I'm talking about the mask manufacturing technology is given by DRDO. There are many opportunity which we are seeing, and it is the right time how an Indian can an SME can utilize this opportunity and see that it reaches all the nook and corner, particularly for countries like us. It is a huge volume, huge potential, but we have to reach. Definitely, we need a support of government at state level and as well as the central level, where we can able to reach the need-based people, where we can able to cater to the requirement, and where we can able to, by reducing the cost. When the volumes are more, definitely our manufacturing cost will come down. So this is the opportunity where we can able to look into. That is my
Thank you,
comment
Mr.
on.
Kumar. Vishal,
Yeah.
are you online now?
Hello.
Yes, Vishal, we can hear you now. Finally.
Okay. First of all, namaskar to all of you. And I would like to thank Mr. Vinod Kumar sir, Ms. Sushma ma'am, and India SME Forum especially. My journey is like we had started 5 years back with a vision to see India into a golden bird again. When the lockdown started, it's been a very crucial stage for us because our neighbors are going back and we are trying to, stop them. We are giving them money, we are giving them food, but still they had their family and we understand each other of them because see, they have their family. We are humans and they are humans and we need to serve them. So we have served for 2.5 months. But because we don't have that kind of work, we are into research and development development of electronic goods. So somebody called from government that what you are doing. I said that I'm just doing research and development in my home only. So they asked me to develop masks, N95 masks. So we had started with them the same day, and I know, and it's been 3 days. I cannot able to sleep. I just completely work on N95 masks, their layers, what the criteria and what the raw materials we need to make the mask. So after 3 days of long working, I rushed to the market, and the very severe demand is there of the raw materials. We are not getting adequate raw materials and not good quality raw materials. People are bluffing, people are selling fake things. We have faced many of the rough challenges in the market. And second of the most crucial challenge is of the certification. We got 2 failures from DRDO. Our mask failed from DRDO. So by the night we got the mail from DRDO that your mask has been failed. So the same day in the night we rushed to Gwalior because Gwalior is the DRDO center. So we rushed to Gwalior, and by the morning we are into Gwalior, and we requested that what criteria you need, what the thing, because see, nothing is on internet and we only can see the criteria of NIOSH. But what the N95 is, we can able to see only from the market. So that criteria is not going to work in the DRDO. So we had requested them to give the criteria, and we have developed that thing. Then we got the certifications from DRDO, and because see, it's our family business, and my mother told me don't try to earn a single penny into this thing. So we did the same. We didn't earn a single penny. We have served the organization. We have served many people. Whatever the people we are taking masks from them, we are just giving from the raw material cost, from the production cost, and we are giving to them. See, this is generally what I personally believe.
Vishal, that's
This
bad
year we
business.
have learned management, and this year we learned discipline. what I feel.
I understand, Vishal, but that's bad business. So you are doing a great social service right now, but the people that you are selling these masks to, are you sure that they are not making a profit, need profit out of
No, no.
them?
Yeah, they are making the profit, but the thing is, see, they are all making the profit, but they are, they are not selling the mask with their ethics. They are selling fake masks, fake products, and that we are not going to do, because see, what we see in India in next 25 years, we can develop semiconductor here. I have researched and developed few sensors for the body, few sensors for thermometers, and few sensors for testing kits also. But because of lack of semiconductor facility in India, we cannot able to do that. Again, I have tried for that China, but see, the China is not going to help us because we are into very conflict with them. After that, I have contacted Taiwan and Vietnam, so I got some of the help, and we are developing some of the sensors which can able to help the body of human being to get, you know, to get a notification before he gets attached or touched with any kind of viruses like in the market or in the field we have. So we are
Yeah,
working
but
on that
I
side
think
also.
you do make smart watches with activity and health trackers and all that, right?
Right. That's what that's why that's what we are going to do. We are going to embed that sensors into the smartwatches and also the covers of the mobile. So if because phone and device is the main product which we are carrying day by day, smartwatches and mobile phones. So we are going to embed that sensors into the mobile devices and also to the smartwatches. So if you are a COVID patient, if I am the COVID patient, and if I'm just meeting someone, it will be that my device, my boss will let me know that no, don't get me traced with them. He is a COVID patient. So we are developing that kind of body. It's a enable sensors we are going to develop, and if India will be a semiconductor thing, and we will win against China if we have a semiconductor facility in India.
Okay, cool. I mean, I'd like to go to Miss Williams last. I mean, we've all spoken about a lot of things that we are all doing in India. What do you think are the opportunities in Nigeria today? Some of us
Thank
might
you.
want to work with you and try and see the opportunities there. Here, Binoy has put up his hands.
All right. Thank you very much, Vinod. I have really listened with interest to all contributions, and I do agree. There are opportunities even in the crisis. For instance, Nigerians are a very entrepreneurial set of people, just as Indians, because I understand that in India you have factories, even from very, very small rooms. Apologies, I'm joining with my phone right now because of the power outage. So you can see that there are a lot of gaps in infrastructure, even in terms of clean energy. We still have a lot of gaps. So, and hospitals and other healthcare facilities, they need energy. So we should really use this groundswell of entrepreneurial interest very well, channel it, do the research, get the standards, just like Binoy was saying about the masks, having masks that have 40% of space. We really need to do the research and get these things right. Some sanitizers in Nigeria, for instance, had to be withdrawn from the market because they were not of the right specifications. So we really need to go back, do the research, get this right, and then create some clusters so that we have, okay, Abba, for instance, in Nigeria is known for garment making. You can make the PPE, the scrubs, the mask in millions. They can do that in Southeast Nigeria. There is a center for that. So we can empower that cluster to meet local demand and export if we can find off-takers, across the world. Now, the second opportunity I think is very, very important is for all countries to establish a volunteer corps. Just like the US had for their Marines, we are going to need to start training healthcare workers on a 24/7 basis now. Take some people out of retirement, let them serve as cell heads, and then we need to establish those vocational training, those public health training institutions, so that we can have even health workers on reserve just as you have reserve army commandants and combatants and all that, we need to have a reserve of healthcare workers if we are going to surmount and excel at dealing with any other healthcare challenge in the future. So there is that human capacity development opportunity there. And I dare say that for the first time in Nigeria, on the news yesterday, I heard of the establishment of a private public health institution. You know, prior to now, government does everything. So another opportunity now is for private sector to also look at some of the social services like healthcare and begin to set up fee-for-use diagnostic center, X-ray centers, and so on. I am a public-private partnership operator for 13 years. I run a public-private pharmacy in one of the government hospitals. And I don't even know where the key is because we've never closed. We don't go on strike. Oh yes, Vinod, we don't go on strike. We don't join the labor unions. You know, we're there to serve the citizenry. And it has been a very, very interesting experience. So we need to have that happen in a mortuary. We need to have that happen for digital X-ray. We need to have that happen for lab. We need to have that happen for various other aspects of healthcare as an opportunity for the private sector to take. And finally, we need to change our behavior. Thank you, Vinod.
Very correct. Very correct. I'd love to go forward and keep on listening to all of you. You're great guys, all of you. I mean, and Miss Williams. I mean, I'd say pearls from everyone. But Sushma just nudged me that I have crossed over, 15 minutes into the other webinar's time. So sorry, Sushma ji, please come back and take care of this now. But I'd love to speak to all of you on this subject, sometime again, hopefully very soon. Thank you for being such a great panel of experts.
Thank you.
Thank you. Yeah.
Thank you. Great being here.
Thank you.
Thank you very much. It has been a pleasure listening to each one of you. And I would like to reiterate, in fact, she echoed my sentiments in words. I would like to reiterate what Ms. Peo Williams said. She said very important thing is, how you treat others is how you get treated back. And as Indians, we believe in karma. So what goes around comes around. So I think it's high time we took lessons from this pandemic and we treated our health well, because I'm studying some figures, and what I gather is most of these COVID cases are in metros, and most affected are the state of Maharashtra and Delhi, whereas a state like Bihar, which has most villages, is only affected 1%. Okay, though all the workers have migrated back to UP and Bihar from these states, and the COVID situation is just 1%. So I think we have to stop abusing nature and stop living this wild lifestyle that we all have been living. And I agree with Ms. Williams that it's the behavior. I think we need to start introspecting and treating our body as a temple and not abusing it and looking after it very well. And I guess it's high time that we, lived a balanced life, a happy life, and not just go after things wherein we are just exploiting this nature, and nothing is going to remain after 50 years for next generations to come. So with that, thank you so much once again. And I wish you all to stay safe, stay healthy, and be happy always. Thank you very much.
Thank you.
Thank you. Thank you very much.
Thank you, Sushma ji.